Start unpacking the President's announcements last night. I'm joined by WIT's Health and Social Security Systems Specialist. It's Professor Alex van der Heever. Prof, always a pleasure speaking to you. Thanks, as always, for your time. Just your general reaction to last night. I imagine from a health and social security perspective, if we're hearing the President repeating that this is about saving lives, it's going to be difficult to argue against much of what he's put into place, isn't it?
Well, the focus in terms of measures, has been on attacking the gatherings, the super spreading contexts, which are really driving this particular surge. So I think that he's done basically the maximum he can do without huge damage to the economy, although certain parts of the economy are definitely going to be impacted. But it was pretty much expected that he was going to have to do something to deal with the crisis, although probably it won't have a huge effect on what happens over the next 2 weeks.
Why do you say that? I was reading something very similar last night, just trolling through social media as the President was speaking. There was a number of experts saying that it's probably not going to make a significant difference to the numbers. Why would you have that view?
Well, we're seeing two provinces where the surge may have begun to trail off, the Eastern Cape and the Western Cape, for one. KwaZulu-Natal is still rising quite significantly, so they are in a precarious position. Gauteng, it's very unclear at this point. But the original lockdowns that we had didn't necessarily have a huge effect. It's actually unclear as to what effect they did have overall, because they sort of trailed off. They reached their peak at a point when we had actually begun reducing lockdowns. So it's unclear as to what the lockdown was achieving in those particular instances. So I think that it might be that when people start to see friends and relatives getting sick, their behavior might become more cautious, and there might be quite localized immunity, herd immunity that might occur in certain contexts as well. But I think this surge has been driven by super spreading events. It's now internationally sort of better understood that when we see this kind of rise, it's not because of individuals infecting each other. It's super spreading events that are particularly driving the epidemic, which means that if you have measures that target super spreading, you will actually bring down or control the epidemic from a prevention perspective. Although vaccines are the best way of containing this epidemic going forward. I'm
so glad, Prof. van der Heever, you led me into vaccines, but that was actually going to be my next question. Up to now, it has been, the money has been paid, it has been signed off, the vaccines are considered safe for South Africa. It's been the first quarter of 2021. That's what we've been hearing up to now. As of last night, it's now the second quarter of next year. 3 months when we're fighting a virus like this is going to make the difference as far as getting on top of it quicker. And also it's going to result in more people losing their lives the longer it takes for us to get this, isn't it so?
Yeah, it's unclear as to why we're so slow at getting off the starting blocks, getting out of the starting blocks on the vaccine process. I see today Morocco has secured 65 million doses. We've got a number of developing countries that are securing very significant numbers of doses, and they're rolling out already. So it's very unclear as to why South Africa is only looking at maybe June, July, when it's going to begin rolling out, when in fact we would benefit right now from a rollout vaccination program targeting frontline healthcare workers. And by the way, government wouldn't even have to pay for it because all frontline healthcare workers are on medical schemes, which means that all we really require is access to a vaccine.
When these questions are now going to be asked over the next few days, is, in your opinion, knowing how readily available this vaccine is now, you just mentioned Morocco, we've been reporting on Europe and America for a couple of weeks now. Are you aware of any way that this can be sped up? Do you think this is a lack of financial clout? Do you think this is a lack of planning, or as far as government is concerned? And do you think there is a way, through a negotiation or a trade exchange, something, Prof, that the government can do to try and get this vaccine here earlier? Our frontline workers are 50,000 plus are sick. Those with comorbidities are dying on a daily basis. Surely there's something government can do. What would you suggest?
Well, I think that the bilateral arrangements, this COVAX arrangement, it's too far in the future and can't be relied upon for our sort of frontline protection in South Africa. We essentially need to negotiate on a bilateral basis with pharmaceutical manufacturers and just get on with it. It's eminently feasible. A large number of developing countries have already begun rollouts. So it's not as if Canada and the United States and Europe are buying up all available doses. That's often raised as an excuse, but it is. But it appears it's unclear as to why we are so slow in getting off the mark. So I think big questions have to be asked of what people are actually doing at this point in time, because we can't keep using lockdowns as our strategy for dealing with surges. And there are going to be multiple surges going forward. This isn't going to end now. We can't afford in April, May, when we go into winter, when we will face another surge, and attempt to deal with that with another series of lockdowns. We don't have the financial resources in government to be able to provide social security to the people who are then affected. So, and right now, government can't even pay salary increases because of the declines in tax revenue and its inability to access capital markets to finance the deficit. So we're in a position where we've got to prevent this epidemic in a cost-effective way, and vaccines are incredibly cost-effective as a strategy. It costs us an entire strategy to get us to about 60% coverage. Will cost less than 1 day of the generalized lockdown that we had in March, the level 5 lockdown. It is insane that we aren't making full use of vaccines at this point and doing everything we can aggressively to negotiate, including the companies that are where South Africa is carrying out clinical trials domestically. So the AstraZeneca trial, Johnson & Johnson is available is being produced in South Africa. Why are we not setting up an arrangement and immediately looking at it to roll out with our priority healthcare workers at this point, and then the rest of the country?
Professor Alex van der Heever, I could not have said it any better myself. Why are we so slow off the mark, and what are we going to do about it? What are the ministers and the government going to be doing as of this morning to hurry up and get this vaccine here into South Africa? Always a pleasure speaking to Professor Alex van der Heever from the WITS Health and Social Security Systems. He's a specialist for WITS, joining us here on eNCA.